conference is ENAD BSN-2A. So for today, I'm going to demonstrate the CHN bag technique. So CHN bag technique is a tool by which the nurse bring from home visit. So for today, I'm going to explain or the tools that given. So first is soap, plastic wrapper, paper wrapper, the paper lining, the washcloths, the waste receptacle, the apron, the towel lining, the match, the test tube holder, the dropper, so the kidney basin, so the medicine cup, disposable syringe, disposable needle, the thermometer, the sterile tongue disperser, the tape, the pack of syringe, the tissue, the cotton balls. So we're going to the denatured alcohol, the acetic acid, the hydrogen peroxide, the benefic substitution, the spirit of ammonia, the sterile water, the soap sod solution, the isopropyl alcohol, the sphygmomanometer, and the stethoscope, and the lastly is the CHN bag. So that's it for the equipment that we use. Now we are done introducing all the equipment. So now we are going to perform the procedure. So first thing to do is we need to open our bag to pick the paper lining in this area, in this table. So then I'll close my bag. So as you can see, the paper lining is now in the table. So I will set up the paper lining. So I will open the paper lining to expose the paper lining. So now, as you can see, the paper lining is now exposed. So the next I'm going to do is I'm going to set aside the bag, the CHN bag. So now I'm going to ask my patient. So hi ma'am.
Hello.
So I'm going to perform hand washing.
Okay.
So where is the area po?
Inside the kitchen.
Oh,
Okay.
so now I'm going to pick the materials that we needed. So now I'm going to open the bag. So now I'm going to introduce the equipment that we use to hand washing. So first is the soap, the tissue, and the washcloth. And now I'm going to close the bag. So as you can see, the equipment is now exposed. So I am going to kitchen area to do the hand washing. So now we are done performing the hand washing. So as you can see, this is the towel. So I will set aside here. So now I'm going to ask the patient, or I will explain it what I'm doing. So, ma'am, I am ELLEAN Francis, your nurse student. So, I will get your blood pressure so that we are know your blood pressure or normal or not normal. So, so now we are going to open our bag to put the all equipment. So this is the towel lining. So in towel lining is we're going to set the towel lining before I am going to put all the equipments that we use. So as you can see, the towel lining is now exposed. So the first equipment is the apron. We are now going to use apron. This. So I am going to set aside this into this area, not to the proper. Now, this is the important, the tissue. The stethoscope. The spirometer. And lastly is the alcohol. So for this, I am now already done to pick all the equipment. So now I'm going to use apron so that my uniform is for my safety of my uniform. So the next thing to do is now I am going to get the blood pressure of my client. So hi ma'am, I'm going to check. So please replace your hand. So your blood pressure is 120 over 80. So mom, your blood pressure is normal. we are now done getting her blood pressure. So the next is I am going to clean the all equipment. And I will use this alcohol to clean the equipment. So I will replace this into this area. And this tissue is I will recycle in this. So now I am done cleaning the all equipment. So we are now going to hand washing. Now I'm already done perform the hand washing. So now as you can see my equipment is now clean. So the equipment that we use is now I'm going to set aside to the bag. Here, the alcohol, the tissue, das this, and I will so I will put this into the recycle bin. I will put my apron and I will put into the CHN. As you can see, the apron is now so now I am done putting the all equipment into the bag. So I will close this and I will put this wrapper into the recycle bin. So now I'm done performing the bag technique.